Afternoon, everybody, and a big thank you to Dr. Rajendra Gupta for inviting me here. In this panel of eminent scientists, I'm supposed to be the lay person, probably because I was a policymaker, but that's why I'm here. So I will approach it from that standpoint. Long COVID or acute post-COVID syndrome is characterized by multi-organ symptoms lasting 2 months after initial COVID. Overall, 10 to 35% of COVID survivors develop long COVID with common symptoms including fatigue, dyspnea, chest pain, cough, depression, anxiety and post-traumatic stress disorder, memory loss, and difficulty concentrating. Delineating these issues will be crucial to inform appropriate post-pandemic health policy and to protect the health of COVID-19 survivors, including potentially vulnerable groups. Directed at saying, we must also suggest avenues for future research with the larger goal of reducing harm associated with long COVID. According to the World Health Organization, long COVID is defined as a condition occurring in individuals within 3 months from the onset of COVID-19 with persistent symptoms that cannot be explained by an alternative diagnosis. Given the vast emerging literature on this new public health concern, there is a need for up-to-date review on long COVID syndrome. Important epidemiological and clinical aspects of the disease need to be reviewed to provide an international public health context. Cardiorespiratory sequelae, physical and mental health problems, rehospitalization rates, risk factors, biomarkers, and the impact of vaccine status on long outcomes. Long COVID was originally coined in the spring of 2020. And was used to describe anecdotal observations of prolonged symptoms after COVID. Despite attempts at delineating a practical definition, there remains variability in the consensus and rigor of a systematic definition. WHO provided a clinical case definition for long COVID using a Delphi consensus via an international working group in October 21 involving patients, patient researchers, external experts, and WHO experts, among others. The WHO also created a global COVID-19 clinical platform case report form for clinicians and patients. But however, the major barrier in this was accurate assessments in general is the biases in self-reporting or the underreporting of mild cases. There is limited information on the specific impacts of long COVID in youth. They were in discussions with youngsters and children. About 8 themes were extracted on how children of their families describe the experiences. Seeking diagnosis and support following the onset of the symptoms. Emerged from the analysis include severity of the illness and the symptomatology, difficulty surrounding the diagnosis process and not being believed, the impact of family and social connections, positive coping and mental health and knowledge. In addition, as of March, I think there were 677 cases of COVID have been reported and this thing. And in addition to the direct infection, there's also been medical, psychological, and economic aspects. Vaccination efforts to reduce the spread and severity has been very successful, but subsequent variants have also shown to be less severe. Much focus has always been on the direct illness and spread, but as the pandemic wound down, there were renewed efforts towards understanding the long-term impact of the viral infection. Long-term COVID, known as post-acute sequelae of is a condition in which people affected experience lingering symptoms for weeks or months after they recover. However, given the recency and the interest surrounding, there are many case definitions that disagree on its symptomality and prognosis. There is a wide range of symptoms. According to the current diagnosis is predominantly based on prior infection. Meta-analysis studies reveal that 31 to 67% of COVID people will go on to develop long COVID. And the long-term rate of this has been reflected in the JAMA network open this thing. Another study found that symptoms continue to be reported following in pediatric cases, included but not limited to fatigue, difficulty, falling asleep, neurocognitive symptoms, dead or heavy feeling after exercise, rashes, allergies, pain, and hair loss. Another study also explored, this is a population study based in and from the Public Health 2022, included severity, referred to recurrent COVID, this thing, hospitalization, etc. Let's see. Time up. Okay. Long COVID, I would say, is saying in India, I mean, of course, we had the Maulana Azad study, which is saying there also there was no definite the thing that has come about. But today there is a study being done by the Indian Institute of Public Health in Ahmedabad, and they are looking at trying to collate all the studies and come up to it. Long COVID is definitely a chronic condition, but we do not know the exact nature of the burden. We need to have studies to look at how do we try to do this. And though we are past the epidemic stage, we need to sing, we have to sing. WHO did take note, and it made it loud and clear that it needs recognition, guidelines, research, and ongoing patient input and narratives to shape the WHO response hereon. For us also, I think it is important to give proper consideration to the voices of people with COVID and their representatives who have done so much to put this on the long COVID, on the health research and policy agenda. That's what I would say.